Questions now from the party spokespeople. UKIP spokesperson Caroline Jones.
Minister, whilst in Bridgend last week, I was spoken to by a constituent whose neighbour was released from hospital just days after suffering from a stroke, yet they didn't have, again, any care plan in place. The individual concerned had no family nearby and was left to fend for themselves. Unfortunately, this constituent situation is far from unique, as 5 weeks ago I reported on someone who had a triple heart bypass in the same situation at the age of 83. I have been made aware of many instances where patients are discharged from hospital without the appropriate care plan and ongoing care in place, forced to rely on the kindness of their neighbours because the state has let them down. Minister, what steps is the Welsh Government taking to ensure that all vulnerable discharged patients from hospitals have a care plan in place?
Well, thank you for that question. And can I say, first of all, if the individual items of that case, if you want to bring them to my attention, either write to me or if you want to meet with me, I'm more than happy to discuss them and see what can be done in that individual case. One of the biggest factors in front of us is the issue of delayed transfers of care, of course. And I don't know whether that was a material factor within this particular instance. But certainly we are aware that in the ABMU area, in particular, the significant increase recently was a result of delayed transfer of cares, and I wonder if that hit on to the impacts. But I'll have a look at the individual instance you refer to, and we'll see what can be done.
Thank you for your answer, Minister. Of course, the Social Services and Wellbeing Act is supposed to transform the way social care is delivered and ensure everyone who needs care gets care. Unfortunately, this isn't always the case. Not only are we seeing patients sent home without anyone to help meet their care needs, but we also have large numbers of patients in hospital far longer than they need to be because they have no ongoing care package. The latest delayed transfer of care statistics show 462 people in hospital far longer than they need to be. The majority of these patients spend around a month longer in hospital because there is no community care available or there is lack of care home spaces. Minister, it is a well-known fact that the longer these patients spend in hospital, the longer their recovery will take. What is your government doing to eliminate delayed transfers of care?
Well, again, I thank you for that further question. And it is a real issue, and it's an issue that we invest in both expertise and competence, but also funding in and working with health boards and local authorities on the ground. We have seen an increase in the August period, and it's an increase that we hadn't seen in the previous 18 months. And two of those areas were ABMU, Abertawe Bro Morgannwg, and also Hywel Dda. So we're directly supporting local authorities in their efforts to secure additional service capacity and to make, I have to say, more effective use of the provision that is already available. And part of this is joined up working in those regions. We do expect health boards and local authorities to continue to work in close collaboration, making the best possible use of the intermediate care funding which we've made available, to ensure that improvement is sustained and that capacity issues are addressed ahead of, as we all know, the forthcoming season of winter pressures. There is some optimism here, however, because we do see areas which are doing well in this areas of delayed transfers. So in the Powys Health Board region, for example, delayed transfers of care continue to be lower than historical levels, and there have been issues before, despite periodic fluctuation. And the latest published figures in September show a 31% reduction in delays in comparison with the previous month. So it does show, within the existing capacity on the ground, things can be made to work, but it takes some joined-up thinking.
Thank you for your answer, Minister. We are well aware that social care is facing increase in demand. Unfortunately, we are not meeting that demand. This is highlighted all too clearly by Age Cymru's recent Caring Crisis report. Age Cymru found that older people in some parts of Wales were not getting the required carers assessments and that there was huge variation between local authorities. The Social Services Act was supposed to end the postcode lottery of care, but we are still finding that some local authorities are better than others in delivering this package. Minister, what more can your government do to ensure that local authorities fulfil their duties under the Act and ensure that budget cuts do not impact upon their ability to fulfil these duties? And I would also like to say that whilst monitoring this situation across my region, I have noticed within the region different standards of care being given to elderly patients, and I'd like to speak to you at some time about it. Thank you.
Thank you again.